While the height of the COVID-19 pandemic was certainly in 2020, the CDC continues to report new cases of the virus each year. Today, test positivity remains at 9% according to the CDC, meaning the possibility of contracting the virus still remains. While the threat of illness still remains omnipresent, many individuals were and still continue to be hesitant to get vaccinated for numerous reasons. This is particularly true for people of African American descent, who have become fearful of mass-distributed medicinal treatment as a result of events that have transpired throughout history.
When I was coming back to Howard, it was like a matter, they were afraid I was going to lose my scholarship for athletics, so they were like, no, you need to go get the vaccine, because if you don't, then you can't go to those meets, and school money is very important, Howard is expensive, so I ended up listening to my parents and I got the vaccine. It was like the worst decision. I regret it so much. It was like a very negative experience for me.
White feels that taking the vaccine goes against her beliefs, calling the multiple rounds of vaccinations shady.
Personally, I believe the vaccine, the way that the administration was pushing it, and peers around me, it was based a lot in fear. And I don't think that there was enough time to create the vaccine. I feel like it was just kind of thrown together in this short period because people were freaking out about COVID.
Dr. Lane Williams is an internal medicine doctor at Walter Reed Hospital in Bethesda, Maryland. His experience with treating individuals with COVID-19 has made him privy to a number of concerns that prospective patients have regarding their treatment.
And I think that's an overall key when it comes to the disproportionate care for African Americans, because oftentimes we just don't have the access, we don't have the resources to get the health care that perhaps other groups of folks do have, and that already puts us at such a high disadvantage.
Dr. Williams believes the key to solve the community's trust is clear communication between the doctor and the patient.
When that virus came out in 2020, people were dropping dead by the masses, especially the first few months alone. That was, I think, even when we started to implement masks, and the vaccine does work. And I think, though, it takes a team approach. They have to come to people who they feel care about them and tell them, hey, I think you should get this vaccine. Here's why. Here's what I want to do as your provider. And as a patient, what do you feel comfortable with doing? And together, perhaps we can come up with a plan to implement, safety precautions to protect you and also your loved ones, because the vaccine isn't just about you. It's also about those that you're around as well.
According to the National Center of Biotechnology and Information, approximately 97.9 out of every 100,000 African Americans have died from COVID-19. Zoe Warner has the rest of the story.
While some believe in getting vaccinations from hospitals like the Howard University Hospital behind me, others believe in different methods for staying safe during COVID.
I would definitely advise for people to get the COVID vaccine, just because it's a baseline sort of protection against the illness. It works specifically against that illness and protects you against that. And if you were to pair that with herbal remedies, you could target any specific symptoms that you might have caught once having the actual vaccine.
Zakoy James is a current student at Howard University who strongly prefers holistic medicinal alternatives. For him, taking herbal medicine has tied him to his African American ancestry.
The use of herbalism, though, dates back to Africa from before that transatlantic slave trade. People have been using herbs for both medicinal and spiritual use, seeing it as medicine. That's not something that's new to the African people.
While some of the nation is faced with the decision on whether or not to get the vaccine, many are not afforded that same luxury, as schools or jobs now require it. Melanie White, a student at Howard University, is one of the many who are reluctant to get the vaccine. The graduating senior describes how she felt the process was rushed and how, despite her carefulness, she tested positive for COVID-19 2 weeks after reluctantly getting the vaccine.
And it was actually like a week or two after I got the vaccine. So I hadn't caught COVID all the way up to that point. I was not nearly as careful as when I had gotten to DC. And then somehow I got the vaccine and I was careful, and then I caught COVID.
Despite her hesitation with the vaccine, Melanie says that Howard was helpful throughout her time with COVID. Bison Safe, one of the apps designated to campus health and safety, offers COVID-19 resources and solutions for students. From Washington, D.C., this is Zoe Warner for NewsVision.